So the brewery's been around since 1890. How did you get involved in the organization?
Well, I got involved just a little over 9 years ago, basically because I saw they were looking for a CEO. And I was looking at the time for a position to bring me back to Montreal. I was up in the Gatineau area doing some work on corporate responsibility, global corporate responsibility, because I've been involved in a career of international development and global citizenship, education, and that kind of thing. And I wanted to avoid traveling as much as I had to in that career with a young family. And so I was looking for positions in Montreal to bring the family back here. And so I just noticed the Old Brewery Mission. I knew about the Old Brewery Mission in a very peripheral way, and I had an image of it, a large shelter for men. And when I dug into it a little bit to determine whether I was going to apply, I became really impressed with the shift in thinking that had just begun at the mission. Really, it was just the thinking that had started to shift in actual programs and services that hadn't really been very well developed. But they realized we can't stay in the business of offering overnight shelter each and every night without other services. Otherwise, we're aiding and abetting homelessness. We're allowing people to stabilize in a context of homelessness. So that really attracted me. I thought that's something I could get my teeth into. So that's what got me to the Old Brewery Mission. I applied, and in the process, the interview process, and so on, they ended up selecting me.
So you mentioned come back to Montreal. So you grew up here?
Yes, I grew up here. I was born in Calgary, actually. But as I say, my dad mom and dad were from Montreal. They moved out to Calgary after my dad graduated. Well, actually, both of them graduated from McGill. He in commerce, and he took up a job in the oil business out there. And as I say, with the business savvy that my family is famous for, my dad realized in 1960 there was no future in the oil business.
Wow. Forward thinking. Okay.
Wow. Yeah, really forward thinking. Like he missed the wave.
Yeah.
But, and so he said he was going to come back to Montreal.
Okay. Interesting.
And so he brought the family back here. So yeah, I grew up. I was 6 years old when I came here, and I grew up here. Yeah.
You run a 24-hour a day, 365 day a year organization.
Yeah.
Obviously, you have to have a lot of people. I mean, how large is your staff and your volunteer base?
Well, yeah, it is pretty large. The staff contingent is large. The volunteer contingent is not as large as most people think.
Okay.
I think a lot of people think this is essentially volunteer-driven at the mission. It's not. People have even asked me what I do for a living because they assume I'm volunteering here.
Wow. Okay.
So there's a mistaken impression amongst many out there about the seriousness of what we're doing here. So we have about 200 people who have an employment link to the Old Brewery Mission. That doesn't mean full-time employees in every case. Some of them are on call. But we have about 165 active employees. And that's from the kitchen to cleaners to security staff to counseling staff to healthcare providers, drivers, there's all of those categories here.
And there's a women's mission as well as a men's mission now.
That's right. Well, that's another thing, because as I said earlier, when I was thinking of the mission when I was applying, it's for men. And that's the image people have. But in fact, we're the largest service provider to homeless women in Canada.
Really?
And so the issue of women in homelessness is an abiding preoccupation of our organization.
Okay, you've been quoted saying that 40% of homeless populations suffer from mental illness. Can you talk about the relationship between homelessness and mental illness?
Yeah, it's very serious, obviously. It's serious in a number of ways. One is that mental illness for about 40% of the population is the reason they're homeless. That's essentially untreated mental illness is leaving citizens with a life on the street. And what kind of a society can we be proud of that lets people who are ill be out on the street? If you've heard me quoted, you probably heard me quoted saying, would we ever tolerate this for cancer patients?
Yeah.
Cancer patients be out on the street. Well, they're homeless because they've got cancer. You know how that goes. We'd never tolerate that. So how on earth can we tolerate it for mental illness? ones. So basically, we were never set up as a place to receive and to address the needs of people with mental illness, but we've perforce become an entity. So we've been fighting against that for years and years, pushing back on the institutions like the Douglas and others to stop thinking of us, and for the Ministry of Health and others to stop thinking of a homeless mission as a suitable place, landing place for people with mental illness. We've been fighting that, but we had a shift in our thinking there, saying, okay, the fight is a good fight, but we still have these people here, and we're not getting the kind of change that we think will help relocate these people into something that's more adapted to their needs. So we said, let us at the same time start to develop services, try to forge relationships and partnerships that actually provide the services they need, rather than pretending they shouldn't be here, but since they are, let's do something about it. Essentially, that was our thinking. And we've done some really groundbreaking stuff as a result of having shifted our thinking on that. When we say 40% of the population suffers from some kind of a mental illness from mild to significant, in the population of women that we serve who are homeless, it's about 80%.
Wow, seriously?
Yeah. So when you go to visit the Patricia McKenzie Pavilion, again, the largest, that's the largest shelter in Quebec for women, and you get a very different feel. You get a very different feel than when you go into the men's pavilion. Not just because it's women and men, but because of that, the intensity and the magnitude of mental illness there.
A lot of the people who come to shelters like yours seem to be slipping through the cracks of the healthcare system, as you said. What do you think are the main things that could be improved in the system outside of you?
Well, I think we have to, and this is not just in relation to mental illness.
Right.
This is my observation about healthcare entirely. Is the system has to be able to adapt to the needs of the individual rather than the other way around.
Yeah.
We all have to. We're all round pegs fitting into a square hole, which is the healthcare system. This is the healthcare system. Take it or leave it, and it doesn't account for your particular needs. Of course, if you go in with a broken leg and I go in with cancer, the treatment will be different. But I think there are categories of need, categories of our population that need to be dealt with in a different way. So the homeless population, the one that we work with, you can't expect people who lead a disorganized life and a life of dependence on organizations like ours to be able to fit into the long waiting times in a room, where all of a sudden you miss a bed for the night because you're sitting in an emergency room waiting for a doctor for hours and hours. You miss a meal. You can't go to the canteen. You don't have the money to go to the canteen and have a bite to eat, so you're not eating. You're not, and the system doesn't account for that. That's how I think the programs that we've developed have ended up working well, is because we're adapting the system to the individual.
In general, family caregivers. By caregivers, I mean spouses, parents, siblings, roommates, even friends, are very important in the recovery process for people with mental illness. It's something at AMI-Quebec we deal with a lot.
Sure.
Are you seeing a lack of this type of caregiver support system with people who come to the mission?
Well, often they're at the mission because they don't have a social support system, either family or friends. They could have had it before, but you know better than I do, I think, the burden on caregivers, because these are people who are, teachers or archaeologists or, bus drivers. They're not, they want to give care because they love their family member, but they're not equipped and tooled up to be able to do this. And so often, over a long period of time, just people get worn down. And so they need to take care of their own health, and they drop the individual just because of survival, the need to survive. or burnout or whatever. And so those people lose their support and they are on their own. And so they gravitate towards the mission where we are equipped to provide support and ready to do so and able to do so.
You forged a partnership with the Department of Psychiatry at CHUM. Can you talk about this new partnership?
That was kind of got a staff person, the director in charge of this, of the initiation of this project with the CHUM. He says it was like throwing a bottle into the ocean and pushing it over to the shores of our neighbor here, the new CHUM, and having it wash up there and hope somebody's going to pull the note out and say. So I think it's an interesting image to have. It was like we're crossing our fingers and hoping that it would land on in front of someone who says this is the idea, and that's exactly what happened. Now, in reality, what it was cold calls into the psychiatry department, but we met with a very receptive audience of doctors, psychiatrists, who have been struggling themselves with how to get better results for the amount of time they're spending with patients. And they were realizing we've got to break out of the institution and get into the community where people are actually experiencing their illnesses and in the environments within which they find themselves. And so we got a ready audience in ways we didn't get when we did the same with the MUHC. That's not to say they wouldn't be interested. I just think the bottle didn't arrive at the right shore over there. But it did at the CHUM. And so we've got a tremendous program and really an engaged institution with our institution.
And they're in-house here?
They're probably in here right now.
Yeah.
And what that means is, what it looks like, it's called the Projet de Réaffiliation en Itinérance et Santé Mentale. So it's a reaffiliation, hooking someone back up with the healthcare system because they've broken away from it for some reason, and adapting, making it hook up in a way that meets the needs of the individuals. So it's alarmingly simple in ways that these things often are. You know, the solution is often is more simple than we think it might be. So what does it look like? We've got one dorm that we've basically devoted to patients who will be followed by this program, and it's a room with partitions, so they've got semi-privacy. It's not bunk beds; it's a single bed, and they've got a place for their belongings and so on. So they've got a calm, peaceful place to be. It's not a 5-star accommodation, but it's clean and it's well cared for, and it's I think appropriate under the circumstances. It's far better than what you get in a hospital. And then we have a counselor from the Old Brewery Mission who is devoted to that project. There's 18 beds in the men's, and there's 10 beds for women. So that's 28 beds. I think that's I've been told by the Department of Psychiatry that Old Brewery Mission has the largest number of psychiatric beds, care beds, in the province, including the hospitals. I mean,
wow!
So we're the biggest.
Wow!
As it's turned out,
it's amazing.
Yeah. We're not talking about Pinel and Douglas and their services. But we're talking about hospital and care providers. Psychiatric beds. OBM is now the largest. So we've got a dorm that's devoted to that. We've got a counselor who's focused on and knows the clients and create the link with the psychiatrist. We have a psychiatrist who's here, I would say half-time. And they're inside here. The doctor's name is Olivier Farmer. He's sort of the pioneer of santé urbaine, urban health, this notion that you adapt healthcare in an urban environment differently than you do in other environments, and it's kind of a pioneering thing. So he's completely on board and dedicated, and he's been from the CHUM side the real pioneer of this. We have a full-time social worker from the CHUM, and he's a social worker in psychiatry, and his place of work is inside the mission. So he's also that link between the healthcare system and the mission. We have a half-time psychiatric nurse who's here. And that's just the PRISM project itself. So it's quite simple. But obviously the CHUM has invested in this because they're paying the salaries of the psychiatrist and the nurse and the social worker. We provide the space available, make that available to them. So they've got office space. They tell us it's nicer office space than they would have been getting over the CHUM. So they're happy, and we're happy, and all of the staff now feed in if they identify a beneficiary who comes in and they think, oops, this person may need to be attended to, then we can refer them, and so it accelerates the access of individuals to healthcare.
Right.
What we're seeing, if I can go on, I don't know what your next question is, but what we saw right off the bat, and we continue to see, is that once we can stabilize people with medical attention, clinical treatments, these people are ready to move out and be housed.
Right.
And they are moving out and being housed. I don't know what the figures are now, but there would be, I would hazard to say, 60, 70, or 80 individuals who were homeless chronically, for some of them for decades inside our walls, who are no longer here after a week and a half of treatment, not 6 months of treatment. And so it tells you that these people should not be here because if they could just get the health care they need, we don't need a big tower to homelessness down here on Saint Laurent, Saint Antoine. 40% of our beneficiaries would never have needed to identify themselves as homeless. And they would have, some of them decades ago would have been out of homelessness back into. Now the people who move out of here move out of homelessness, but they remain in poverty.
Right.
So it's not as if they go on to a glorious life and they're not living in a penthouse on Nuns Island or something like that. But they're they're first of all outside of a context of homelessness. They are no longer homeless. They are in sometimes adapted facilities and sometimes they're in apartments, and they get the supports that are necessary. They're not homeless anymore. And we're talking about people that you would walk by, or a Montrealer might walk by and see someone and say, that guy's going to be homeless for the rest of his life just because of his behavior and so on. And those same people, after stabilization and treatment, and Emmy has probably seen this many times, is how a little bit of intervention and stabilization and ongoing support is the recipe. 2
weeks. That's unbelievable.
Yeah, we have. I'm thinking of a case. The first guy who went into the prison project, he was in his early 70s or something. But he wrote those for 20 years. He was peaceable. He did not cause a ruckus or any kind of a problem, and so he was kind of a shadow inside the shelter and was going largely unnoticed. Everybody knew him, but he would talk to himself, but he was lost inside himself. And he went into prison. They got the medication he needed, the diagnosis first of all, the medication, the follow-up. And within a week and a half, the voices he'd been hearing were either not there anymore, or not with the same intensity. And then it was just a matter of finding him a place to be. And another week we did, and he was gone. He's never come back. He's fine.
Wow.
Fine.
Yeah.
He's mentally ill, but
he has his life back.
That's right.
I mean, you kind of jumped the gun on a few of my questions. Clinical nurse said, we see so many miracles here when discussing your program. You said the availability of housing is the cornerstone of any solution to homelessness. Yeah. Can you talk more about the housing program?
Yeah. Well, first of all, and if you've researched, you probably heard me say this because I say it fairly often, to give an image to people is that people aren't homeless because they lost the keys to their apartment.
Right.
They have abiding issues, but nevertheless, one of the key ingredients of homelessness is the absence of a stable place to call home. And so whatever solutions, you have to consider giving people access back to a stable place to call home. Doesn't mean that that's an apartment on their own. Some are fine with that, and others are not going to survive or thrive in that kind of environment. Sometimes supported group living is the right solution. But we try to guide ourselves by what the individual wants themselves, what they identify as something that they want, and we try to get them access to it. So we have to think, as I said earlier, people in our programs move out of homelessness, but they stay in poverty. So we have to find an affordable means, ways to make access to housing affordable. And so rent supplements are really important. It's far cheaper if people say, oh, now we're going to be paying rent for homeless people to be in apartments. It's way cheaper than keeping them here.
Yeah.
You know, pay a couple of $100 a month for someone to stay in an apartment. The quality of life is much better, and they're not in a homeless environment, and it's cheaper. So what's not to like about that? And so we can look at the mental illness, we can look at physical illnesses, we can look at drug addictions and try to moderate that and help people gain control of their lives again. But unless we can give them an avenue to a home to be in, then they will be mentally stable, physically healthful, not consuming much in the way of drugs, but they're still inside a homeless environment. So that's why I say it's a cornerstone. It's not the be all and end all. It's not the only thing, but it's got to be there. Some kind of stable access. We don't go in for transitional housing at the Old Brewery Mission. There's lots of organizations that do. You can stay 3 months. You can stay 3 years. After that, you have to go. We don't subscribe to that. And it's not a value, laden criticism of what exists out there. We just think that the people inside our walls have a whole bunch of swords of Damocles hanging over their heads, and one of them is unstable housing. So whenever we give access to housing, we want to make sure for the individual, we're not looking at our watch waiting for them to move on. We want them to feel they can take a deep breath, and where they are is where they can be for the rest of their lives if they want. Quite often they'll move on, but in a positive way, because of the supports that we provide and the counseling interventions that we maintain.
Well, you mentioned that the financial aspect. You've even said that taxpayer support, it's a much less if they're outside of your system, outside of your walls.
For a donor and a taxpayer, I mean, those are the two supporters, and they're the same person.
Right.
You're a taxpayer and a donor.
Yeah.
Then it's a better proposition either way.
And so how does the, you said continued support outside of the walls. So basically there's follow-ups, checkups, kind of things like that?
Yeah. Again, because of this notion that there's a number of issues that cause someone to be homeless, not just the absence of a home, is when you get them housed, many of them are going to need ongoing support. Sometimes once every month you just pop in and have a cup of coffee and see how people are doing. Other times more intense to make sure that they are staying okay. We're not looking to create perfect citizens. We're just looking to enable people to feel I'm back in society and in a place. One of the things we're noticing as we do this, and we're having to learn as an organization.
As you go,
as we go, we're learning. And one of the things that we're realizing is, for better or for worse, a shelter environment offers at least a social milieu for individuals. They develop friendships, they meet people, they hang out, and when they go to an apartment or go to housing that is more autonomous, because they're still in poverty, they end up in an apartment that's a basic apartment. We don't get involved in unhealthful environments. We won't select a place if we don't think that it's clean and proper. But nevertheless, there's not much in the way of furniture. There's not much in the way of the various accoutrements, and so they're in their apartment and they're far from the only social network they have. And we're trying to figure out how the role of a counselor in the community, when they go out to support the individual, can actually work to plug them into some of the existing activities in their local area. So we try to find apartments that are reasonably well located to public transit, to social infrastructures, community centers, and that kind of thing, so that they can actually get to them. And then we try to plug them into those activities so that we break down that isolation. What we found was people we'd get housed, they'd show up during the day at the mission. They'd come back here, and at first we were saying, hey, wait, we're done with you.
Yeah.
We've housed you.
Yeah.
We've got other people to worry about. And we've stopped doing that.
Okay.
We've got our cafe next door, the internet cafe.
Okay.
And we find a lot of them that are housed
Yeah.
will come back here because that's where their friends are.
Right.
So we've stopped resisting that. We're
Yeah.
saying maybe we need to rethink our day services, that we would have like a community center where
Yeah.
alumni
Yeah,
of
yeah.
Mission could,
Yeah.
and hopefully over time we'll see them less and less frequently as
Yeah.
they develop and elaborate their own networks outside of this area. But so we're on a learning curve ourselves around how to make a success of rehousing homeless people.
Your housing program, you've said that beyond making it sustainable, you want to use it, create it as a template that other organizations could use. Could you see people, around Montreal or even nationally or globally using this as a template for their own system?
Oh yeah, I think so. Well, I mean, we're not only offering, we're learning as well. We're a learning organization. We have 2 researchers full-time on staff that are connected to McGill University because we think building knowledge is important for our own services, but we want to make that available to others. And so we're learning a lot from others. We're not the only ones that are housing homeless people. It really is the current and most common approach in North America to handling homelessness is getting people back in housing. Housing First was not invented by the Old Brewery Mission. It was invented by a Canadian, Sam Simbaris, who lives in New York.
Okay.
And he was a business guy, and he saw homelessness around him, and he said he wanted to do something about it. And he said, maybe the solution is not to figure out how to better treat them inside a shelter, but get them the hell out of there in the first place and get them into housing. So anyway, the point is, what we say is there's a rethinking that needs to be done at the front end of services. We've thought for too long in terms of shelter. People don't have a place. They need a place. Give them a place. They got to have a bed. There's no doubt that's the case. Tonight there will be somebody coming for the first time. Got to have a place. But we have to think of ourselves differently. Shelters have to think of themselves differently. We have to think, and how I've sort of started to frame it is, we don't, at the mission, we don't think of ourselves as a shelter anymore. We think, so we're not an emergency shelter service, we're a social reintegration service. That's our job. So our job is to get people back into society. We of course offer overnight accommodation, and that will always be the case as a means to get people into services. But this is the last year that the Old Brewery Mission will offer purely the traditional sense of shelter. We have as many beds, but these people are all in programs. They're all working with counselors, and they're all in the process of moving out. We're going to put 600 people out of here back into society every year. So it's a real engine of reintegration. And I think once we define ourselves that way, we're not a shelter, we are an engine of social reintegration, then everything flows from that. And that's the model that I think we would like to propose for other shelters. Because of the wave in housing, a lot of shelters are resistant because they're not sure where their role is anymore.
Right.
And I'm saying, if you don't have a role, then get out of the way, or transform yourselves, because there's no place for any longer. I think there's no acceptable way that organizations that deal with homeless individuals should content themselves with just offering overnight accommodation and meals, as we did for 120 years. So it's a self-criticism we're making. But we've gone through that process. We said, okay, well, if you're doing something and it's not the right thing, stop doing it and start doing the right thing. Or, like I say, get out of the way. And so that's the message that we sort of convey to the community.
You've recently formed a partnership with the police department. There was, it was in the papers, there was a shooting death here. It seemed like that was a catalyst, possibly for this, but can you talk about this new relationship with the police department and how they face people with mental illness and homelessness? There
was the shooting. It's not the first shooting by the police of a homeless person, but it's the most recent one, and it happened right here, right outside our doors. So in the past, when there's been deaths deaths of homeless individuals at the hands of the police. We have been, in the media talking about it, and one of the messages we have conveyed all the time is to the police is, if you would like, we're ready to help you to get involved in police sensitization and training around the homeless population, or people who are in crisis in the public domain, people who are having a psychotic event or some kind of a breakdown. We can help you. They don't have to be homeless. So, but if you think we can be helpful, we'd like to, and we're ready to. And basically, there was never any response from the SPVM to that. But in fairness, I didn't pick up the phone and call. I just, in my interviews, I would make that point. When it happened here, then we picked up the phone. Because it was like, okay, just a second. It's not just that it happened at the mission, but that was a galvanizing thing. I think it was like, okay, if it happens right outside, there has to be a response from the organization that was just witness to this. What I said is enough. We're not just going to, I'm not just going to do the same interview I did when Mario Amel was killed, or, others. So I picked up the phone. I said, we have to talk. We have to talk. And I went to the police chief. And so essentially, he agreed. So we met. And what I found in Philippe Pichet was a guy who's coping with a heck of a lot of stuff right now, especially. It's a heck of a job. But I think he realized there has to be evidence on the part of the SPVM that they are open to changing their methodologies, their approach, and their training, and so on. And so I found a very receptive guy, and I put a few things on the table for him, and he picked them all up and took them. And we're acting on them now. And so, of course, there's the training. We're starting the first one, I think, on the 1st of May or around then. We'll be involved in sensitization trainings on shift changes. When police change shifts, they've got a 20-minute period where they can receive some, have conversations with groups or organizations, or they deal with specific themes, just sort of mini sessions. And so we're going to take part in those. We're going to deliver sensitization. So before they go out on the street, little sensitization session with some of our counselors and some of our staff who are frontline workers on how we operate when we're dealing with people who are in crisis, and our methodologies. So we're going to be starting that shortly. We've been working with the SPVM to structure them and get a schedule together and that kind of thing. But I also said that it's not just training the police. The police and the homeless people have to come in contact with each other outside of conflict. And so come to the mission, serve meals at the mission in uniform, so you look like police, don't look like the average Joe, look like police. And serve meals, smile, chat with them, and give them an opportunity to exchange with you outside of a situation where they're bending your arm behind your back and pushing you to the ground, and that kind of thing. And so they've started doing that, and we have police. I said, come to our cafe. It's open to everybody. You can go in, anybody can go in. It's open to the public. If coffee's free, Van Hoot, it's good coffee. And I said, so come in when you're on the beat walking by, just come in, have a coffee. You don't have to, we're not going to stop and say, everybody, look, there's a police officer. Just come in, sit down, talk with people, get up, go, that kind of thing. Just have that kind of interaction. So that's happening.
That human face to it.
Yeah.
Last question. You've been with the brewery since 2008.
Yeah.
What do you see as the future 5 or 10 years down the road here?
Well, it's already we're already seeing the future. We've laid out our path, and the path is to convert the mission into a place of rapid evaluation, assessments, and referrals. So the front door will always be open. Everybody who needs to can come in. And then So a place of triage, if I can put it that way, where we meet with everybody who comes to our doors, determine what their needs are, meet their needs as much as we can, and have them move on out of here. So our objective is to end chronic homelessness in Montreal. Homelessness as a lifestyle won't be able to happen here at the mission. You won't be able to stay anchored in homelessness month after month, year after year, because you'll be triaged and then you'll be referred, and then we will become increasingly a supported housing organization. So we will provide supports to vulnerable individuals. So homelessness will cease to become an issue. You become homeless, and then you get housed, and so you're not there long enough for it to become a phenomena, social phenomena, in the way that it is now. That's really the idea of the Old Brewery Mission. Already, housing is the largest thing that we do. So when I say where are we going to be, it'll just be more housing.
Yeah.
And I would say probably another angle that we then might become involved in is the matter of prevention in the first place, trying to halt it.
Proactive.
Where is it coming from? And we're working with just starting to work with some really interesting young people, young neuroscientists and people from a fledgling organization called the Decision Lab, and they want to look at some of these causes of social issues. Where do homeless people come from? How far do we go back? To the education system, to the fabric of families? Do we train people to become better mothers and fathers in ways the school system doesn't touch at this point? Those are some of the questions I think we'd look at, is how do we prevent homelessness from happening? Probably we can't stop it entirely, but we might be able to narrow it down and have less people falling into that situation. But even if they do, it won't be as big a deal as it is where people are now living in homelessness. You know, they're earning their living out on the traffic corners, you know, bumming for change. And you know, how can we bring that to an end? So that's in 5 years there'll be no more chronic homelessness in Montreal. That's our vision. Homelessness will be a brief, tragic episode in somebody's life, but especially brief, and the cost of homelessness will go down to taxpayers and donors, and the Old Brewery Mission will be a very different kind of a place.